recognized for 5 minutes.
Thank you, Secretary Becerra, for being here with us today. Since DOPS, Republican politicians have been attacking women's reproductive health care and in turn jeopardizing the lives of millions of women. Can you tell us what steps HHS has taken to ensure that women continue to have access to comprehensive reproductive health care, including abortion?
Congresswoman, we've taken a number of steps. Obviously, everything will fall short of what the protections that Roe versus Wade had provided to women. But, for example, we have gone all the way to the Supreme Court to protect a woman's access to medication abortion, mifepristone. We have gone all the way to the Supreme Court protecting a woman's right to emergency care services. We are continuing to enforce laws that require providers and insurers to offer contraception services to women. We just issued a rule that would protect the privacy, health information privacy of women and their providers, so that that can't be used against them. I could go on, but I suspect you have more questions.
No, thank you so much for that answer. I'm really concerned about the epidemic of the opioid crisis that we are looking at, that is shattering the lives of thousands of people across Minnesota. My family has lost close and personal friends to this epidemic. In Minnesota, opioid-involved overdose deaths increased 43% from 2020 to 2022. The number of deaths has more than doubled since 2019. Indigenous Minnesotans are dying at over 9 times the rate of white Minnesotans, and Black Minnesotans at over 3 times that rate. And we're seeing a disturbing increase in addiction rates among the East African immigrant population. I'm deeply concerned about these disparities and about ensuring that hard-to-reach communities are receiving the care and services that they need. I see that in the budget, you have requested $1.6 billion for the state opioid response grant and $2 million for the youth prevention and recovery initiatives specifically. Can you tell us what steps the agency is taking to make sure that the federal funding is going towards culturally competent care? And how are you going to serve the underserved populations?
And Congresswoman, we are making every effort to try to encourage states to adopt culturally competent programs so that they can reach populations that are often neglected or underserved. We continue to try to stand up opportunities for them to get funding to increase the number of clinicians and professionals who are coming from communities where there is a shortage of those individuals. We could use more resources to really push the envelope on this, but we are making every effort, for example, to also collect data that gives us a better sight on where there are absences of the professionals that we need. And we're trying to also recruit people, help states recruit people who have lived experience, so that when they go out to be the professional, they've gone through some of those experiences that they're now trying to help people with.
Yeah. And it looks like those impacted are getting younger and younger. I know that there are resources that are focused on education and deterrence. What do you think can be done to better assist folks who are already addicted, as well as the parents, considering that many of those suffering are under the age of consent and need their parents' approval for treatment?
I've mentioned on several occasions already how we are trying to get states to adopt Medicaid innovations that would allow us to use Medicaid dollars in a school to provide behavioral health services in a school, so a child and a family member doesn't have to wait until you find a doctor that you can send your child to help with substance abuse or mental health services. We are hoping there are about 15 states that have worked with us to change their programs, their Medicaid programs, to accept those dollars. We have several programs, one called Project Aware, that's specifically focused on children to try to help them address issues like drug use, suicide prevention, and we're trying to expand those services, working with states to see if they'll adopt them.
Yeah. Our kids are really in desperate need, so I hope those services reach them. Thank you so much.
Thank you. Mr. Kiley, you're recognized for 5 minutes.